Hi, my name is Eili Klein. I'm an associate professor in the Department of Emergency Medicine, working on modeling the spread of COVID around the state of Maryland as well as the country, and responding to surges. So currently there are 20 million doses of the vaccine that are supposed to be distributed before the end of the year, and as many as 300 million doses potentially by the end of April. Leading to approximately as many as 150 million people being vaccinated before April. And if that is the case, and we're able to get to that level of distribution, combined with the sort of summer lull in transmission as humidity rises and transmission falls, the result of that will be more of a return to normalcy, and the problems of overcrowded hospitals and mortality related to this disease will fall dramatically. While there is a tremendous amount of optimism and excitement for the summer months and into next fall, there is a tremendous amount of serious trouble headed towards us in the next couple months. And that reality is a combination of factors. One is obviously increased travel due to the holidays. The other is the fact that transmission goes up in the winter. There is a reason it's called flu season, and we tend to see respiratory viruses increase their spread as it gets colder, and people tend to gather more indoors. And so we are looking at, while the vaccine is rolling out and we're starting to see more and more people vaccinated, and that will increase over the next couple of months, that will not dramatically change the epidemiology over the next couple of months. And then fortunately, that means that we're going to continue to see need to social distance, wear masks, and and this will be hard on several small businesses and people. And people who are at risk are going to continue to be at risk until they get vaccinated. I mean, this is the final surge, right, of COVID. Like, once the vaccine is in wide-scale distribution, we're not going to have this problem. We're not going to have to shut things down anymore. We're not going to have to avoid going to each other's houses. And so, but unfortunately, we have to get through the next couple months, and we need to get through the next couple months with trying to save as many lives as possible. And that means, continuing to hunker down. No, don't go traveling. Don't go visit your elderly parents, and continue to use Zoom.